Hello, everyone. I'm Ann Nolan with Lighthouse Coding. Today, we'll go over the 2023 E&M changes for hospital inpatient and observation services. With the 2023 CPT updates came a big change in the way that we code hospital inpatient and observation services. These two groups of services have now been combined into one subsection, which resulted in the deletion of 7 codes and the revision of 11 existing codes. The new subsection is titled Hospital Inpatient and Observation Care Services, and while the title of this subsection includes the word "and," hospital inpatient and observation care services, it is important to note the use of the term "or" that's found in all of the code descriptors that are found in this subsection. The usage of the term "or" indicates that these codes may be reported for either type of service, inpatient or observation. Before these changes went into effect, we used to have 3 sections with additional subsections. These were hospital observation services, which included initial observation care, subsequent observation care, and observation discharge. Hospital inpatient services, which included initial hospital inpatient care, subsequent inpatient care, and hospital inpatient discharge services. And observation or inpatient care services, including admission and discharge. Because caring for patients admitted to observation status is essentially the same as caring for patients that have facility inpatient status, it was determined that the two groups of codes should be combined into one comprehensive new subsection that covers either setting, observation or inpatient. This would also help to create one inclusive subsection of codes for these hospital and observation services, as opposed to fragmented subsections that were often misreported due to patient status being difficult to determine by the providers. These new revisions also align with the 2021 E&M updates, and they make use of medical decision-making or total time as the means for determining the code. So which codes were removed? The initial observation care codes 99218 through 99220 and subsequent observation care codes 99224 through 99226 were deleted effective January 1st. In addition, the observation care discharge services section and code 99217 was deleted. Now, to report observation care services, we'll use codes from 99221 through 99223 for initial observation care and 99231 through 99233 for subsequent observation care, which have been revised to add observation care services to the code descriptors. To report observation discharge, we now will use 99238 or 99239, which have been revised to include observation discharge management services. These codes are still reported based on time, with 99238 being reported for discharge day management requiring 30 minutes or less on the date of the encounter, and 99239 for discharge day management requiring more than 30 minutes on the date of the encounter. 99238 and 99239 may only be reported if the initial services for admission to the hospital as either an inpatient or observation are performed on different calendar dates. If the patient is admitted and discharged during the same encounter with only one visit, we would report a code from 99221 through 99223 as appropriate. If the patient is admitted and discharged on the same calendar date with 2 encounters, then codes 99234 through 99236 may be reported as appropriate. These same-day admit and discharge services, 99234 through 99236, were also revised by replacing the old 3 key component requirements with medical decision-making or total time as the means for determining the level. Just remember, to use this range of codes, there must be at least 2 encounters on the same date, one of which is the initial admission and the other of which is the discharge. As stated previously, these 2023 revisions are also consistent with the revisions that we saw in 2021 for the office and outpatient E&M services, where we're now using medical decision-making or total time as the determining factor of our level. The time element for selection of these codes has also been updated. Whereas prior to 2023, time was determined based on the time spent at the patient's bedside and on the hospital floor or unit, now in 2023, we're allowed to use the total time related to the patient care on the date of the encounter. This total time is based on calendar date, and per CPT assistant, a continuous service that spans the transition of 2 calendar dates is considered as a single service and is reported on 1 calendar date. If the service is continuous before and through midnight, all of the time spent may be applied to the reported date of service. Let's look at a couple of examples of discharge services to see how the new guidelines work. A patient with an acute uncomplicated illness or injury is admitted for either inpatient or observation care services. The patient is discharged later the same day. Since the service includes 2 or more encounters on the same date, one of them being the initial admission encounter and the other the discharge encounter, this will qualify for a 99234. Here's another. A patient receives a hospital observation discharge day management service that requires 27 minutes of total time. That will be coded to 99238 because we have a discharge day service documented on a different day than the admission service, and the total time is 30 minutes or less. These are beneficial changes for providers and coders alike. In time, we'll get just as used to these changes as we have with the 2021 revisions. Thanks for watching.